I'm going to talk about survivor bias and cancer, and specifically cancer research. So, what spawned this was I went onto Reddit, one of the cancer subreddit, which has some nice support for people going through cancer, and I put my story up there and got basically there's an oncologist who's on there who was going, oh, blah, 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 blah. No oncologist would tell you. And I go, well, okay, look. So let's talk about, so I said that, well, first off, let me give you a bit of background about myself. So you understand, I'm not a doctor. I'm not a medical doctor. Don't get me wrong. I'm not a doctor. But I have a very interesting perspective. So one of my first jobs, not my first, but one of my early jobs I got working in a company doing respiratory therapy software. So we did software for calculating how a patient would respond to various respiratory treatments. And I did a whole bunch. There's a lot of math, and I went through a lot of that. That was an interesting job, but it was my first introduction to medical demography and so on. And so you understand a little bit about patients. And so that was my introduction to healthcare. Anyway, after that job went on, then I ended up at several years or many years later, ended up at another firm doing archiving of medical imagery. Now this falls under a whole protocol called DICOM, and it's a complicated process. But what happens is that the classic state was where they started this with was mammograms. A woman goes in and gets a mammogram, and if they see a spot on her mammogram, if it's a tiny spot, they watch it, and then they'll go back have her come back and do another mammogram maybe a year later. And what they'll want to do is they'll want to see the priors. Or if she sees a spot, they'll say, can we see the previous mammogram? So storing all of these mammograms takes up space, and most radiological centers and hospitals only have enough storage for about a year. Because of all the regulations, it's extremely expensive to add more storage. Yeah, that's the bureaucracy for you. But I was dealing with a software that dealt with some of this, and so I learned a lot, and I got introduced I became a member of HL7, which is an interesting group, and they design how patient information should be stored. Anyway, there are a bunch of standards groups that I ended up working with regard to that, and so that was another job. Then I left that one and ended up at another job doing, I had two tasks, and the first one was to architect a clinical data trials software to manage the software for entering data for clinical data trials, which included all the design of the forms and so on. And I did that one, and then the other system I did was for preparing submissions to a variety of health authorities. So I got wrapped up in all of that, understanding how you submit to the FDA and the difference for submitting the submission for a drug or a medical device to Health Canada or to Japan or all these different agencies. And I left that job and ended up another job doing the same thing, but with the health authorities. So over my career, I have been deeply involved in healthcare, not by choice. This was not the direction I wanted to go, but these are where the jobs kept coming up. So I got into researching this one. Now, one other piece of information I need to mention, because it's how it affects me. When I was a young man, I went into the service, went into the Army, and my right leg started swell up, and it got extremely painful, and I ended up in the hospital. And after 2 weeks of bed rest, my right leg is swelled 2 inches in diameter larger than my left leg. And after bed rest, it finally shrunk down and left a egg-sized lump on the side of my side of my calf. So they didn't know what it was. And this was my introduction to doctors not giving full information. So I didn't know what it was. We spent a long time. I was in the hospital for quite a while because they were trying to get my leg to swell back up so they could do that. They ran all these tests. It's constantly getting tested, different kinds of tests, doing all these exercises and trying to get my leg. And I had this egg-sized lump on the side of my calf. So they come in and they said, we're going to go in and do surgery. We want to see what it is. Well, up to that point in time, they'd never mentioned cancer. Never mentioned cancer. And I go, when we start filling out the paperwork and they start going through what happens if I have various kinds of cancer. And this was an absolute shock. Cancer had never been mentioned. So, and the doctor finally said, you either have an intermuscular blood clot or cancer. Okay, so I go in for surgery. Comes out, and I remember the doctor saying, you're very lucky, it was an intermuscular blood clot. Now this is not an intervein blood clot. What happened, my muscle had actually bled internally and formed a clot, which is extremely rare. I didn't know how rare it was at the time. So when I talked to the doctor, he said that, he says afterward, one thing I says, well, how common or what I had? And he says, I've never seen or heard of anybody else having what you had. That was sort of a shock. So they were expecting cancer, and that's not what I had. But it taught me that doctors know things and they won't tell you. So anyway, it goes on through life, and I'm always been a math type person and so on. So I'm diagnosed with diabetes. And my phrase that I used to say was, you have to make friends with your meter. This is my meter right here. That's my bag with my diabetic meter to test my blood. You have to make friends with your meter. And I said, the reason you have to make friends with your meter, it's the only thing that will tell you the truth. You can lie to yourself. Your friends can lie to you. I didn't eat that much, or you didn't eat that much, or that this little piece of cake won't hurt you, or this little bit more of rice or whatever won't hurt you. Your meter will tell you the truth. And I mean that. It will tell you, we'll test your blood and it won't lie to you. And it's one of the few objective things. So I always learned I wanted to be objective. So when I was diagnosed with cancer this time, as soon as I knew that was the diagnosis, I was waiting for the pathology report to come back, and I'd researched the various survival rates and so on. So when they immediately said stage 4, I knew I had an 8 to 11% chance of living 5 years. And I adjusted my lifestyle because of that. I spent some money and things like that. It was okay because I thought, okay, I don't have a good chance. I'm not going to have a long life. Odds are against me. But I did extremely well through chemo, and through surgery and through chemo, and didn't show up. And I remember when I had my 1-year colonoscopy after I'd had the surgery, and the gastroenterologist said, he says, I spent a lot of time on your colon, going through your colon. He says, you have no polyps. He says, I looked at it intensively at your surgery, and he says, you had an excellent surgeon. And he says, I think you're going to be one of the few that survive. And I heard that from several, that I had done extremely well through this because I had no signs of cancer, No signs of polyps, no signs of any problem in my colon in the colonoscopy after a year after I'd went through chemo, or a year after I'd went through surgery. So I got into this discussion, and one of the things I found this article, assessing the clinical benefit and quality of life when patients undergoing, anyway, there's a whole bunch of links down below to several studies. I found the first one, and this doctor found some other ones. And I said, in these papers, and they say that once cancer is spread to the peritoneum, the one paper I had was, it said 5.2 months was the average life expectancy, was the median life expectancy, not average. The median life expectancy. And the other paper that this other doctor said that it was approximately 6 months was the median, which is 5.2 to 6. Okay. So there are multiple papers that argue that, but they're going, oh, but and I've heard this from all the oncologists I've talked to. Oh, but I've had patients live 4 years. I've had patients live. This I says, yes. We're talking about a normal distribution. If you didn't have a few patients that survived, that says that your statistical model is wrong, because there should be some out at 1 sigma, 2 sigma, 3 sigma, if your population size is large enough. Yes, some people should survive longer. Some people should survive less. That's what probability says. And you get all these doctors, and they go, and I'm slamming doctors, but you have to understand, a doctor keeps trying, look at the Hippocratic Oath, and they go, we, do no wrong, and I think they don't want to tell patients their life expectancy. They don't. None of the oncologists I've ever talked to have said how long they expect me to live, because they don't want to do that. They don't want to say that, because that will set up expectations and make you, no. Look, I'm the kind of guy who looks at the stats. Okay, so now we get into what's called survivor bias. Now I put a bunch of links to videos on YouTube about survivor bias. Now, what is survivor bias? Well, it's the initial work on this was done in World War II. And they were trying to figure out how to increase the armor on planes going out, flying over Germany, doing the bombing, so that they would increase the survival rate of the planes. So the first thing they did was they created a card, and it with the image of the plane, and they asked the people when they came back, mark up where you've been shot on the little card. So they marked this up, and they did the analysis, and the first idea was, oh, those places that get shot, we need to armor. And that did nothing. Actually, just did nothing. And finally the one guy says, no, you're looking at it wrong. You're looking at it wrong. He says, if you assume that where a plane gets shot up is somewhat random, which is a logical assumption because the bullets are flying everywhere, they get hit with flak and everything, so that you look at on the planes that come back, you look at where they haven't been shot. Because if a plane gets shot in those areas, that goes down. That's called survivor bias. Your sample data only showed the results of those that survived. And I read through these medical articles, and I'm not a doctor. Like I said, I've got a lot of background in this, and I'm reading through this stuff, and I go, they're always saying, he says, you'll get the statistics, and I understand why, and I'll explain why they don't have them, but they'll go, oh, but this treatment showed so much promise. We had 4 patients who lived this much longer and this much longer, and I go, survivor bias. There's built-in survivor bias in these studies. They're not looking at the patients that died. They're looking at the patients that survived. and it's skewing the results. And I understand that. I understand the doctors don't want to think about the ones that died because they want to think about the ones that survived. And I got into, like I said, I got into this argument with this oncologist on the cancer subreddit, and I'm going, you're showing survivor bias. You say it, and I said and I would quote him back, and I go, you're actually saying, oh, but I've had people survive, and I go, yes, you've had people, but that's not the ones you should be looking at. What you should be looking at is the total statistical evidence and doing that. Now, the reason that they don't have the total statistical, because it takes years to accumulate all that data and then process it to come up, because you have to have a large enough number to make it meaningful. So what happens is that they're looking through all these drugs and they're trying to find something, and they keep going, I had a patient that survived for 4 years on this. Actually, I remember that oncologist, and they were talking with a nurse, and she comes in every 2 weeks and has been on full fury, which is the chemo treatment, for 4 years. And I'm going, I don't want that. Where's my statistical evidence that this set of treatments that you're outlining for me will increase my life? And I look through the one study, and it goes, oh, it changed the life expectancy. There was the one that gave a little bit predictive. It said it changed life expectancy from 5 months to 7 months. And I go, oh. So I go through 5 months is, if there's 2 treatments a month, that's 10 chemotherapy plus another 2 months of chemotherapy. So I have 14 sessions of chemotherapy for 2 months of life. Now, don't get me wrong. The first time I went through chemo was okay. I was looking to the end. There was an end date. I'm stage 4, so if I start chemo, I would continue chemo for the rest of my life. And the way they do it is they give you as much chemo as you can handle until you can't take any more. Then they stop for a week or 2 till you build up enough strength that they can beat you down again. Well, that's not a lifestyle that I want to go through. I mean, I don't want I look at it's 5-FU, which says a lot about what I think about that particular drug too. You're spending 3 out of every 14 days connected to a bag that's pumping stuff into you, which it's cumbersome. It's cumbersome. So you're spending, those days of your life, you can't take a shower, you can't do things like that. You're always in the bag, and it makes it difficult. I always found it difficult to sleep, and I've been having problems with difficulty to sleep anyway now. But those always made it worse. Oh, but it'll eliminate the side effects of cancer. Yeah, but it adds its whole other host of side effects in there. And so for me, I want the numbers. And this is the problem that I have with doctors, is doctors, one, they don't want to tell you the numbers. They won't tell you the numbers. The only reason I know is because I get the numbers and I go into the doctor. I remember going into the doctor with the printed out study and says, this is what the study says. And they look at it and they read it and they go, yeah, that's what the study says. They won't say it applies to you. And in fact, they'll often say, oh, but that's this, and this, and this, and this, and that doesn't apply to you. Well, why not? And you go, that's the problem. Doctors don't want to tell you the truth. They don't want to tell you the statistical data about your chances of living for X number of weeks or months. Because, well, and you can understand with today's litigious society, we sue them. But so if you want to know, you have to go digging up the numbers yourself, because the doctors won't tell you that. And I was like the oncologist that was on the cancer subreddit. Says a doctor should never tell you that. They go, they didn't. I pointed the studies out to them and asked them, is the study wrong? That's the question you have to do. When you have to be proactive in dealing with this, because I am now convinced, after dealing with 3 separate oncologists, looking through this stuff, doctors don't tell you the full truth. They want to shield you from the problems. They really do. They want, they're trying not to do any harm, not to cause you any anxiety. But there comes a time and place where you want, if you're like I am and want to have a rational discussion about your life expectancy, your oncologist is not going to give it to you. I don't believe that. Because they're always going to go, oh, but I have this patient. And you go, that's anecdotal. That's not statistical. And that's the problem that I really have with the doctors, is that they don't want to say, what are your odds of surviving? And these studies, the conclusions are always survivor bias, and it takes it back. And this is why if you see how drug trials go, they test out the various drugs, and then it takes a long time to determine if they're effective or not. And because you have to run the studies for that, and it's expensive and so on, because of, again, I think because of our litigious society. So they run all these tests, and then finally they come back and say, okay, this treatment works better than this treatment, or this treatment is more cost effective than this treatment because the outcomes are the same, and so on. And you run through these variety of things like that. But that's what your doctor doesn't want to tell you, those things, because they want you to be better, to get well, to be happy, and so on. But they're not unlike your meter. If you're a diabetic, make friends with your meter. Don't make friends with your doctor. Your doctor is going to tell you they're going to give you good advice. Don't get me wrong. But they're not going to give you all the truth, because they don't want you to know how bad things could be. They won't tell you all the possible side effects of the medicines that they're giving you. They'll give it to you, and then you'll think about what happens. It's like years ago, I got put on Diaven. I didn't know Diaven was a high blood pressure medicine. And I took the first pill. I changed meds, took the first pill, woke up the next day achy. Yeah, okay, just, aches and pains. And then the next day, I couldn't get out of bed. I physically couldn't move. And it took me hours to drag myself into the computer, to sit down and do a research and find one of the more uncommon side effects is Diaven is joint pain, excruciating joint pain. And I stopped it, and it took 2 days, and then I was back to normal. So the doctor never mentioned that as a possible side effect. It was not a common one. It wasn't even on, normally you get the brochure, and it wasn't even there. It's only when you start going out on the internet and doing real research to find out what this is. Now, I know that my cancer is not normal. And what do I mean by that? When I got my pathology report back, I got the pathology report before I went in and talked to the doctor, and I'm researching researching all the terms, and I can't remember that, and it's somewhere in some box, someplace, the pathology report. And the problem with it was that there are numbers might be wrong. 94% of all the colon cancers are of this type, and then 6% are of this type. I'm in the 6%. It's not the normal colon cancer. And then I remember there was a phrase on the somewhere where they almost, when they did the colonoscopy for me, they suspect cancer, and they're looking for it, and they said that they almost missed it because it wasn't in a normal place, and it wasn't a normal cancer. So I knew that. The other thing, like doctors will never mention to you, but I found 2 studies that have mentioned it. You have your colon cancer is normally in either the ascending or descending. It's normally not in the transverse. I think it's ascending, transverse, and sigmoid, I believe is the proper name for it. What happens is that, and again, this is my memory, I don't have the numbers before me. If your cancer is in the descending or sigmoid colon, you have I believe it was 6 times better survival rate than if it's in the ascending. Mine was in the ascending. Because you have a better survival rate. Why? They don't know. They really don't know. Your colon is very similar from the ascending and descending, but if the cancer forms in the ascending side, your chance of survival is much lower than if it's in the descending side. Doctors won't tell you that. Well, you don't really need to know that, but it's interesting if you start looking through this. You find out a whole bunch of things about this stuff. And, I look at this, there are a whole bunch of treatments coming out targeting colon cancer. They're a couple of years away before going into clinical trials. And so that's, and which means they're probably years away from actually getting rolled out into general treatment. But I believe that doctors, particularly oncologists, have rose-colored glasses and only look at the survivors. And you think about it, would they really want to dwell on the ones that didn't? I mean, what's the phrase, a doctor, most people have to live with their mistakes, doctors bury them, I think is the joke. But they don't really want to look back and do the analysis on all of those that died that didn't work out better. So I can understand it. It's a human failing, and I appreciate the doctors for that. But you have to take control of your own life. And particularly when you start looking through, doing some research, and you find the medical articles, if you're looking at those things and the statistics, but I'm the type of person who always wanted the statistics and then know the numbers. And that was, I remember this argument on Reddit, and the guy goes, "Oh, but you can't just look at the statistics. You have to look at all this other crap." And I go, "What do you mean you can't look at the statistics? If you can't look at the statistics, you're calling the statistics wrong. Because the statistics are the statistics. The survival rate is the survival rate. And yes, there are outliers. You're going to have that's what statistics predicts. You're not all going to be, you're not all going to live 5.2 months. That's the median. You're going to have some that live much less. You're going to have some that live much longer. It's a normal distribution. And if your distribution isn't normal, it's something like a Poisson or some other distribution, then you have to adjust how you calculate your statistics. But statistics, that's what statistics is all about. You should be doing the statistical analysis. But doctors are not going to do that. And I firmly believe that for their own sanity, that they have a lot of survivor bias. So that's why I decided to put this together, because I got so upset with the oncologists I've been dealing with, because they're living in la la land. They're living in survivor land. They only want to look at the survivors. They don't want to look at the full statistical evidence. Because every one of them has said, I've had patients that lived so long. And I go, what difference does that make? That's, you're placing a bet on your life. Yes, I want to win that bet. And I know I'm not. That was, I think it was Carlin who said life insurance is you're betting against the insurance company that you're going to die, and they're betting that you're going to live. And I want to continue living, but I want a quality of life. And if I had to go through 14 treatments of 5FU to guarantee 2 months extra life, I wouldn't do that. And that's what the closest statistics that I could come up with. Because that's the median life expectancy. Now, could I live longer? Yes. Could I live less? Could I live a shorter period of time? Yes. In fact, the odds are 50-50. So that's the whole thing. So I am worried I'm worried that this survivor bias is infecting the studies. And from the studies that I read, I haven't read a lot, but I'm terribly worried for others that the survivor bias that I'm seeing in these studies is going to show up and affect other people. So if you have a problem, some disease, go do your own research. The internet is out there. It can give you a lot of information. Look through it. Make your own analysis. When I go to the doctor, I often prepare 3 documents. One for the nurse, I give the nurse a list of all my meds, my current doses and everything else, so they can check that. The second one is the list of symptoms that I had, and ideally when the symptoms started. And the third one is a list of questions. So I can go into the doctor and say, what about this? What about this? What about this? And ideally those questions are based upon your research. That you go there and you see this, I see this, I see this, and you can make informed questions. You're asking intelligent questions that the doctor has to think about. And I've actually asked some questions that have stumped the doctors, yes. There are 2 questions that were always, my wife had, when she was young, she was bitten by a dog, and she actually went through the full rabies series of injections. And the question that we have is, well, does that mean that she's immune from rabies? And never did get a good answer on that one. And then the other one is, you have these questionnaires that go in, and they often ask you, have you ever had this and this and this? I'm one of those people that had scarlet fever. And I remember asking the doctors, and they go, oh, why did you ask? I asked, why did you ask about scarlet fever? They go, oh. And most of them don't know. And one of them finally got back to me and says there can be an effect on your heart from scarlet fever, which I didn't know. Nobody had told me, but I had scarlet fever when I was a little boy. So, and that's very rare anymore. My sister talks about whooping cough. She actually had whooping cough. My brother died from whooping cough. So, and she came in and they said she'd been exposed to whooping cough, and they said, okay, what do you have to do? Well, because the disease has changed over so many years that she still has to be treated she had to be get the shot, I think, because of she'd been exposed to whooping cough. So you have to ask intelligent questions and be prepared to ask these questions of your doctor. And understand that your doctor is not going to tell you the full story because they don't want to burden you, because it could depress you, could do things you don't, it's like most people, okay, you're diagnosed with colon cancer. You don't need to know, you want to know what's my prognosis, not, oh, what if, what if my cancer had been on the other side, my prognosis would have been better than if it's on the side that it was on. You don't need to know that, but and the doctor, there's no reason for the doctor to go into that. Those are what ifs, but those are interesting things that you'll find as you start looking through this. And take a look at the studies, ask intelligent questions of your doctor, respect their opinion. It's what they are. They're the doctors. But be prepared for them not to tell you the entire truth, because they won't. And they have a real problem with survivor bias. And I think the studies have a problem with survivor bias. So I just wanted to rant about this one. So thank you for watching. I encourage you to look at some of the survivor bias videos below. To me, they were really kind of interesting, but then I'm a geek, so I don't worry about that. But it's, and there are some really bizarre cancer treatments that they've been looking at, and yeah, there are some that are scary. Well, the one was the hyperthermic, one of the hyperthermic treatments where they basically, they drain, if I remember correctly, they reduce your body temperature by oh yeah, this one just sounded terribly bad, but it was a possible treatment for people in my condition. Though it's, I don't think it actually got much traction, but there were various different places that do various things. So take a look at studies out there, do some research, ask questions of your doctor, and be prepared for incomplete answers. So thank you for watching my video.